we spoke about how you ventured out into the heat of the city because you had to do a grocery shop, and you and Christina, obviously responsible people, you donned your masks, right?
Yeah, you know what? Regardless of which store we go to, we always bring our masks just because you get so close to people, regardless of which way the arrow is going to be. Just for your own comfort and peace of mind, we bring our masks.
Right. And I was mentioning how I, for the first time last week, while we took that week off, ventured out to the grocery store because I had been doing online shopping and delivering, and ventured out to the grocery store. And I was actually expecting to see people wearing masks en masse. Not so much. It was about, a 70-30 split. And Dr. Jennifer Kwan is a family physician from Burlington. She's providing daily updates on COVID stats on her Twitter account at jkwan_MD. And she's getting quite a following. There's been a lot of mixed messaging regarding masks and their effectiveness against COVID-19. And the province is saying you should wear one. Then we have Mayor Tory apologizing for wearing one around his chin while he was talking to the masses in Trinity Bellwoods over the weekend. A little bit of a shock for me when I went out, as I said, and didn't see a lot of people wearing masks at grocery stores. But I think it's important to have the conversation about masks on the show with Dr. Kwan, because yesterday we were going back and forth and there were listeners that still felt unconvinced that masks were the way to go. I welcome Dr. Kwan to the show. Welcome. Thanks for being here. I appreciate it.
Thanks for having me. Good morning.
Okay, so you've become a bit of a Twitter darling, actually, during this pandemic, because people have started to follow you. Why did you start posting information on the stats for Ontario's fight against COVID? Why did you start doing that as your part of your daily update?
I joined Twitter in early March, and I started posting because at that time I was getting very concerned about the COVID-19 situation, because I was following news from around the world, and I saw that the situation was getting more severe, but I felt like in Canada nothing was happening. Nobody was concerned. Everyone was just going up to large events. So I wanted to start raising awareness so that people could, become safer. They could start socially distancing, just kind of giving more information. And when you see the stats that are published every day on the website, it's hard to understand how it compares to previous days. So I started creating graphs so that we could watch the curve and really understand the severity of the situation.
When you talk about the website, you're talking about the Government of Ontario website, and at first they would just let us know the amount of new cases and the amount of cases that had been rectified, people that have gotten better. But since then, they've broken it down into demographics. You're still posting info. What are you compiling there? What is the province missing when it comes to stats and mask wearing in general?
So I compile the daily cases, deaths, tests, kind of tracking the trends overall in the province of Ontario. There's still a lot of data that people are looking for. So one is, for example, the ministry does publish the long-term care cases and deaths. So we can see now that most cases are not in the long-term care, but most deaths are in the long-term care homes. So that's very important to know. But that's also a cumulative stat. So we don't know how much community spread is happening, like today, and as a trend. So that is important. And also the ministry has been starting to provide more information in terms of retirement homes, group homes, and other higher risk settings. So I'm glad that they're providing more information, because the analysis is only as good as, the quality of the data we get.
Canada's not yet implemented universal mask policies. Where's the confusion when it comes to masks?
Initially, masks were not recommended for asymptomatic or well people, because perhaps they did not understand the importance of asymptomatic transmission, which means when someone doesn't have symptoms, you can still be passing on the virus to others. So learning from countries around the world who have been very successful using masks as part of the COVID-19 policy, places like Korea, Hong Kong, Taiwan, and also European countries like Czech Republic, even Spain and Germany have done it. So we're learning from them so that we can also implement mask policies to keep our Canadians safe also.
But there's a big pushback. I mean, people think that masks are not going to keep them safe. And, they're leaning on prior conversations that the government's had about touching your mask, and possibly you'll inadvertently touch your face. You mentioned something interesting on a blog post that I read. You said there are unlikely to be any rigorous systematic reviews of multiple randomized controlled trials of masks specifically for COVID-19 infection control anytime soon. However, the absence of evidence is not equal to the evidence against. Can you expand on that and help us understand why? Because I think there's a lot of people that are leaning towards the evidence against.
That's a really good question. So a lot of people in the scientific and medical communities look for, evidence-based randomized control trials where, you have a group of people who may be wearing a mask and then other group of people not wearing a mask, and then you expose them to the virus and see who gets infected more. Something like that would be considered like a randomized controlled trial. It's a lot more complicated than that, but that's kind of the gist of it. So in this time with COVID-19, it's not really feasible to have kind of like large studies demonstrating this. However, we can extrapolate information from, how we know masks work in other respiratory, kind of other viruses that masks do work in that way. We know that masks are used in healthcare settings for other diseases, so that we can also make use of a precautionary principle, which means where you're not 100% sure, you can you can be extra cautious and do the extra cautious step, which would be wearing a mask. Now that there's more emerging evidence with COVID-19 showing that there are more studies being done to show that masks are effective for COVID-19. So hopefully there will be more public messaging to help people understand the importance of masks and that protect other people.
Yeah, I saw you retweet something yesterday where a scientist, took a mask, put it on, took 2 Petri dishes, coughed into one of them wearing the mask, and then coughed into the other without the mask on, and the amount of bacteria in the second one was just unbelievable. So it just showed the difference that masks made. You conducted a Twitter poll, if business implemented a face mask policy, would that affect your shopping habits? What was the finding there?
So the finding was that the majority of people would actually increase their shopping habits at a store that had a mandatory mask policy, probably because they felt safe. They felt like the store would be taking consideration health of their staff and customers. So some business owners may be worried that if they implement mask policies, it will scare customers away. However, the poll showed that majority of people who answered the poll actually would go to that store more. So masks are actually good for both health and the economy.
Yeah, wait, you and I both mentioned Loblaws, because I went to a superstore last week and I noticed that its employees were not wearing masks, and we seemed very comfortable with each other. We're talking way too close to each other. I also noticed that most of the customers weren't wearing masks, and you tweeted something out about that just the other day. Based on the findings of your poll, it seems like is it just that we need to be told to wear masks? Are we shirking away from wearing masks because we don't want to look like the people that are overreacting? Do you have any feel of that? Any sense on why most people are, not wearing masks?
I think it has to do with people like to make their own personal choices and freedoms, and I get that. And there has to be exceptions for people with medical conditions or disabilities or children who cannot wear a mask. That being said, I really hope that everyone understands that the mask is, a sign of showing that you care for one another and you want to protect one another's health. And if we can each wear a mask when we're in higher risk settings especially, then it kind of normalizes mask wearing, and it shows that, we care for one another.
Yesterday we were talking about Trinity Bellwoods and just how much of a debacle that situation was on the weekend at Trinity Bellwoods, and how tons of people packed into Trinity Bellwoods. Today we're finding out that the mayor is considering social distancing circles. So you put circles on the ground, and basically this allows people to get in the circle, enjoy some sun, and if there's no circle available to them, they have to take off, leave the park. What are your thoughts on this? Do you think that's going to work as a way of keeping community spread down?
I think that it's a really cute idea, actually, because there has been some pictures with other places that have done that. I still would recommend people to wear a mask if, when you're walking around to your circle, you might still encounter other people within a 2-meter distance. I think it's important to allow people use of these green spaces and other open spaces because, people are cooped up in their apartments or condos or other places. They may not have a backyard. So it is good to have space for the public to use, but it has to be done in a very safe manner.
All right. I appreciate your time today, Dr. Kwan. Thanks for joining us. If people want to follow you on Twitter, where should they go?
My Twitter is JKWAN_MD, and I post daily COVID-19 Ontario updates.
Excellent. Well, I really appreciate your time. Have yourself a fantastic afternoon and stay safe.
You too. Take care.
Cheers. That is Dr. Jennifer Kwan, a family physician in Burlington. She provides daily updates on COVID stats on her Twitter feed.